here we have the lasers. So if you have plantar fasciitis, if you have tennis or golfer's elbow, if you have rotator cuff tears, muscular tears, if you have osteoarthritis or even rheumatoid arthritis, this is something which can be incredibly effective at helping you get out of pain and healing much faster. So in particular, it's kind of those chronic injuries, especially like plantar fasciitis, where people have had it for months and months and months. They've gone to see lots of other people. Finally, they take a punt and come and see me. And this is where I've had some spectacular results. So what is it? How does it work? And how can we use it to help you? So it's a laser. So this is the applicator. It shoots stuff out of here. It's not doing it at the moment. Don't worry, you're fine. And this is the computer. As we come into the computer, what we'll find is there's a different preset kind of menu for different body parts, so the neck, the shoulder, the hands, etc. And we come in there, and as we'll go into one of those things, we will then come and use the what's called the scan. So the scan, this kind of global approach, let's say this is for your neck. Instead of just saying, right, I've got something sore right here, you think, okay, hang on, I'm going to actually scan all of this area, all around here, to have this general effect. And you do it on both sides as well. Once we've done that, we'll then set it to a more specific setting. So, say muscular contraction. There we go. And we hear a nice beeping. There you go. It is working. Again, we're not going to use it now, but you get it in, and you might kind of just click it on the area. And depending on what's happening with the person, you might I might passively move you, or I might get you to actively move your body through that. So how does it work? Yeah, very good question. And in fact, actually, it's one of the reasons why I'm doing this. So often I'll explain to people what it is, how it works, and why I think it's a good idea to use it with their treatment. And then after we've used it and the pain has either vanished or significantly decreased, they then say, so hang on a second, so how does this work? Because it's when you actually get that incredible kind of change in pain, you think, my goodness, what is this magic? So it's not magic, it's actually really nicely researched, and actually one of the reasons why I went for this particular model is the company that makes this, ASA, it has a research facility in the University of Florence, and so we know that any studies that were done using a piece of kit, that's actually this piece of kit, and often what other people will do is they'll have a look at the research that's out there, other companies, they'll have a look at the research that's out there, and they'll try and make something similar, and then they'll sell that piece of kit. So I wasn't happy with that. I wanted the piece of kit that I used, that I wanted to help my patients with, to be the same piece of kit that actually the research had been done with. So it's great. So what happens with it? So it actually shoots out these two wavelengths, 808 nanometer and 905 nanometer wavelengths. And what they do is the 808 comes in, and the photons, the light, the laser gets into the mitochondria, the kind of the powerhouse of the cells, and it helps to increase the production of adenotriphosphate. So what do we mean by that? If you imagine if you're building a house, the more builders you have, the quicker the building gets done. And that's really what this is. It's creating the kind of the energy currency within the cell, so the cell can do more. As a side effect of what happens with this, and it does this by knocking out nitric oxide and pushing that out of the cell. This nitric oxide, it's a vasodilator. So what we mean by that is it opens blood vessels, and as we open blood vessels, that means that more good stuff can come in, more bad stuff can go out. What this also does is some of the pain receptors that we have in the body are responsive to pressure. So if there's a swelling, for example, one of the reasons we get pain from that swelling is these pain receptors are getting stimulated. So as we decrease the swelling, again, this could be like with your knee, is an absolute classic, the pain level goes down quite significantly. There's also the 905 nanometer wavelength, and that in particular disrupts some of the signals from the pain cells, from the pain receptors as well. Again, it depends on what the type of pain is, where it is, how long you've had it, etc. But these two things can have a really, really strong effect, both on pain relief, which is great, but also on speeding up the recovery as well. And often if you've had something like plantar fasciitis or tennis elbow, golfer's elbow, something that's been sticking around for months and months and months, we're in this kind of cycle of your body recovers a little bit and then it gets injured, recovers a little bit, and for you, all you feel is pain. Whereas what we can do with this, with some of the special modalities or strategies that we have with this, is that actually we get you out of pain and we keep you out of pain most of the time. Again, I'm not going to say that everything's completely, it's not panacea, but you will significantly see a decrease in pain after the first or second treatment, and then as we go through the next few ones, things should start to heal up. Often we have a kind of a 3-2-1 modality, so that means we treat 3 times in the first week, 2 times in the second week, and once in the third week. Just being realistic, that's optimal. So if we're working with a professional sports person, for example, and she got injured, she tore her quad, we'd be using something like that. With today's modern world kind of coming in just to see me, it was wonderful if it can happen 3 times a week. That's great. Often that's not the case, so sometimes it might be spread out a little bit, but if we can have this very kind of intense building block and rehabilitation block, then things do feel much better very, very quickly. So I hope that makes a lot of sense. I'm sure you probably have lots of questions. Again, this is really just to kind of help people understand this basic concept around it, and what it looks like to have it done, why we use it, and so for those questions to be answered. So I hope that makes sense to you. If you have any other questions, please drop me a line. I look forward to working with you very soon.